Now, ever since the World Health Organization has declared monkeypox disease as a public health emergency of concern, another issue that the WHO has focused on is how it is spreading in communities where men have sex with men. That's right. The LGBTQ community has been targeted as a high-risk community where the monkeypox infection is currently spreading. But is the LGBTQ community responsible for the spread of this virus? No. In fact, experts say that sexual contact happens to be one of the ways through which monkeypox can spread through bodily fluids, but it is a contagious disease, so it can spread via touching. If a person comes in close contact with someone who has contracted the virus, if a person touches skin lesions or scabs of someone who has been infected with monkeypox, in dirty linen and bed sheets, and also the healthcare workers who are actually taking care of such patients across the world.
Any person who has skin is naturally at the risk of getting the infection, because skin to skin contact, where the active skin lesions are the mode through which the infection spreads predominantly.
Ever since the outbreak happened in African countries where it is an endemic, monkeypox has not spread as far and wide. But like it happened in the United Kingdom, 2 men were found to be infected with the first cases of monkeypox being reported in the month of May this year. After that, the WHO has said that more than 16,000 cases are being seen across. India also has about 4 cases. Another case has also come to light of monkeypox. But there's no travel history of a recent person who has tested positive. As we said, that sexual contact happens to be one of the ways through which monkeypox can spread, but it can also spread through touching and very close contact with the lesions and scabs on someone's body.
Although it is found in men who have sex with men as the highest risk group, it's not limited only to them.
The problem is that the stigma associated with gays, lesbians and bisexuals is very high. If someone from this community contracts this disease, they most likely will not come out and speak about it, because experts say that it is an indirect disclosure of their sexual identity, which is why many will remain unreported, as is happening internationally across many countries, which is why the stigma needs to be removed.
We need to be very careful that this is the time when many people start stigmatizing those who have infection. Since mothers can also transmit this to babies through breastfeeding, stigmatizing only one high-risk group might be definitely have to be discouraged at this stage.
Experts also say that unprotected sex should be avoided at this point of time. People need to be careful and advocate the use of condoms, just as the national authorities on AIDS also in the country advocate through their programs that unprotected sex should be avoided and condoms should be worn while having sex. That is a strategy that can be taken by the Indian government as well. But social media is rife with reports of whether these men who have sex with men or gay communities responsible for spreading the virus. That is certainly not true.
For more informative videos like this, keep watching India Today News Mo.